and we know who to talk to for National Nurses Week. Hello to you. Tell us who you are and what you do.
Hi, I'm Sherry Joyce. I am the Dean of Nursing at the Good Sam College of Nursing and Health Science. I've been a nurse with TriHealth for 38 years. I've been at the college since 2021, and I've been the dean a couple years now.
So we are always honored to have you here. I know this is your passion, and this past week we got to head into the Good Samaritan College of Nursing and Health Sciences. And I love that because you do more than nursing. You do MA work and things like that, which is exciting. But we found that the future is in good hands. Watch this. Inside this Good Samaritan School of Nursing and Health Sciences lab.
My dad passed away from cancer, and I'd always wanted to be in healthcare.
Students such as Emily Bober are passionate about the care they will provide as the nurses of tomorrow.
I wanted to give back and be able to provide care for other patients and other family members.
They not only learn the clinical skills here for critical care, they learn the life skills to help patients take it one day at a time.
Coming back to school and becoming a nurse, it's incredible. It changes your perspective on how to treat people and how to care for others.
This simulation lab, as it's known, is kind of a refresher for many of these students.
We're trying to help bridge that gap between theory to practice.
Sherilyn Tarter has been an instructor for 2 decades. She says she hopes students will feel what she does about nursing every day.
I guess a sense of responsibility, accountability, and the love of taking care of their patients.
It's pretty clear many of the students here do love this profession and what they can bring to others' lives.
Serving others, to me, is key to my life. I enjoy serving others, and there's plenty of opportunities in being at Good Samaritan College, working with TriHealth one-on-one. It's been an incredible experience.
So it was so fun for us to be in there and see their passion. And my understanding is you can sort of teach the skills, but that passion is something that you hope they just sort of bring to the work, correct?
Absolutely.
Yeah.
Absolutely. It's great to have them in the lab because they're with instructors, they're being mentored, they're being coached on professionalism, communication, before it's a real conversation and a real patient.
It was just very interesting because a lot of them do have really personal stories that inspired that, and that makes just a wonderful healthcare worker. So tell me a little bit about the college. Who do you serve? How do you serve them? How big is it? That kind of thing. It's
big. We have doubled enrollment. We have like 700 students. Wow. When I came in 2021, we had half that. So we've doubled enrollment. We've added a lot of new faculty, and it's a really great team that I've built. And all the support team as well, because there's a dean of allied health, we have an enrollment team, so it's a lot bigger than people think. It's not just nursing. We have rad tech, surge tech, but it's MAs, a lot of programs there, but we all work together. And what's great about it is students, if one thing is not their fit, we have other programs for them to look at as well. But the nursing program has really come a long way. I'm a graduate of the college. I've been there a long time. I have great relationships with the hospitals and TriHealth because I was in management and leadership in the hospitals, and now I'm a dean at the college. So we've done a lot of connecting, collaboration. We're getting our future nurses. We're trying to keep all of them in our system because our students are really recognized for that professionalism, that communication, that critical thinking that we develop. And there are future nurses that are going to take care of us, so that's important.
So we've had a real shortage of nurses, so it's nice to hear your growth. We have a little video of kind of that lab and what you do there. Do you attribute the growth to the expansion of other programs, or have you seen the growth in nursing?
We've seen the growth in nursing, absolutely. They love the hospital-based because we have priority on clinical sites. They love the strength in clinical and in critical thinking that the nurses that we are developing. So we get a lot of compliments from the nurses saying, wow, these Good Sam students, they're really, really strong. So I believe the growth is due to references from others that have gone there, the clinical hospital-based setting, and just the reputation.
It's wonderful to hear that, and for people not familiar, what you're saying is if they work there, then the TriHealth hospitals often will have jobs ready for them, or they train in there. But what was interesting to me is that after COVID, there was a big concern that we wouldn't see people coming to the profession. So how have you sort of overcome that?
We really have. I've heard a lot of nurses that have come out of retirement, ready to come back. They got burned out at the bedside. they left, and they thought this was a great way to get back into nursing, which is great because there is educator shortage as well.
I think that's the thing that people, and your students did reiterate this, they said there's so many different areas now that as a nurse you can participate in. So do you encourage that?
Yes, yes.
Yeah.
So I believe people are coming back to the bedside, and if they're not, they're finding that fit. Where in healthcare can I go and come back? So we're happy to have some people come back that left. We're also trying to retain the students that we are in the school to keep them in Tri-Health. We actually have somebody from Tri-Health, from HR, in the college to help them find the right fit for wherever they want to work when they graduate.
That's so important. I want to give you the final word this National Nurses Week. What would you like to say to your wonderful team members and so many that you've trained?
I want to thank everyone. It's very proud. Every graduation, it's just so awesome to just see how we've contributed to the nursing career workforce, and we're having nurses that are compassionate, that listen, that care, and building that workforce back up.
Yeah, we're so grateful to have you here in our community. It's been nice to just work with your team and see how you've grown. Come back soon, okay?
All right, thank you.
All right, good to have you. I know you're so busy that I always feel like we're taking you right away from all this big need, but it's just so fun to have you in-house.
Thank you for having me.
Yeah, good to have you here. All right, just ahead.